Orlistat is an FDA-approved drug for weight loss. There are many people who use it and eventually decide that it's not working for them, which is fair enough. But before you throw in the towel and look for something else, are there reasons why it's not working for you? Hi, I'm Dr. Brian Young, a naturopathic doctor in Toronto. Let's take a look at some reasons why you might not want to take Orlistat, or why Orlistat might not be working well for you. Orlistat, also known as Xenical or Ali, is a drug that blocks fat absorption in the body. A more in-depth video about how it works and what you can expect can be found down below in the description. Being one of our oldest medications for weight loss, it's a drug very commonly used around the world. So from the experiences of many of my patients who have tried Orlistat, here's some common reasons why it didn't work for them or why they stopped taking it. Underestimating the side effects. Orlistat will cause fat malabsorption, causing fat to end up in your stool. If you've never experienced orange-colored, fatty, oily stools or being unable to fully control your bowels, you could be in for an embarrassing and unpleasant surprise. Sometimes, patients underestimate the social ramifications of having to go to the washroom at a moment's notice, especially if they've eaten something they shouldn't have. Leakage of stools onto underwear is also common, and may be only discovered when changing clothes, which could come as quite a shock since some patients don't even feel the leakage. Even if you're following the recommended low-fat diet, you could still experience some of the side effects, so if you're unprepared to deal with them, you might not want to continue Orlistat. Not following a proper diet. Orlistat is meant to be used with a low-fat, calorie-controlled diet. It only blocks around 30% of the fat you eat, meaning if your diet is too high in fat, you'll still absorb most of it. Also, if you're consuming too many calories from simple carbs, like from pasta, bread, juice, or pop, Orlistat won't block the absorption of those foods at all. You'll need to both cut down on those carbs and replace them with more complex carbohydrates. Orlistat, like many of the other weight loss medications, are only a tool and can help you to lose weight, but cannot replace the foundations of proper weight loss like diet and exercise. Improper dosing. Orlistat is meant to be taken 3 times a day during or up to 1 hour after each meal. The timing of when you take Orlistat is important, as it works locally to block fat. Take it too early, and the drug exits your body without doing anything. Take it too late, and the food has already been absorbed. Remember, it's up to 1 hour after your meal, so try to take it within that time period, not a full hour afterwards. It's frequently recommended that you take Orlistat with meals that contain fat. Some patients will skip dosing on meals they believe have little to no fat. While this makes sense in theory, in reality, many patients underestimate the amount of fat in their meal and mistakenly skip dosing thinking it won't make a difference. If you're having 3 meals a day and only taking Orlistat during dinner because your breakfast and lunch are small, or you're frequently skipping doses to avoid the side effects during the day, it's not too surprising Orlistat isn't working properly for you. Take Orlistat as it's meant to be taken, with each meal up to 3 times a day. It also comes in 2 forms, Xenical, which is 120 milligrams, and Ali, which is 60 milligrams. In my experience, the increased dosing in Xenical does make a significant difference for weight loss. The lower dose in Ali makes it more tolerable, but quite a bit less effective. You're snacking too much. Because Orlistat is dosed with meals, if you're snacking and grazing throughout the day, all the food you're consuming outside your meals won't be affected by Orlistat, and it won't work well for you. You need to either control your snacking or otherwise limit your food intake to 2 to 3 meals per day. If you're drinking too many calorie-dense liquids like juice, pop, or milk outside your meals, this could be a problem as well. Focus on just water, tea, or coffee with no milk or sugar outside your meals with Orlistat. Nutritional deficiencies. Orlistat can block the proper absorption of certain nutrients, particularly fat-soluble vitamins like vitamin D. If you're fatigued all the time and your diet is too limited, it's possible that nutritional deficiencies are hindering the ability of your body to properly burn fat and negatively affect your weight loss. Nutritional supplements or vitamin injection therapies can help to replenish some of these nutrients easily if you aren't able to obtain them from your diet. You're expecting miracles. Orlistat blocks fat absorption and it won't really control your appetite or cravings unlike Saxenda or Contrave, so you won't really feel its effects for weight loss. But that doesn't necessarily mean it isn't working. Orlistat also tends to have less drastic weight loss effects compared to other weight loss medications, meaning the weight won't typically come off as quickly. The average weight lost on Orlistat is also modest, with patients typically losing around 3 to 5% of their current body weight over a few months, so you'll need to manage and set realistic expectations. Also, Orlistat does not work well without a weight loss diet at all. And while some other weight loss medications may initially work for a little while, even without much of a diet, all medications will eventually stop working long term if you lack a good weight loss diet, regardless of which medication you used. So, if long-term weight loss is your goal, the differences in the effectiveness of different FDA-approved weight loss drugs are a little less important if you have a good overall weight loss plan in place. Let me know in the comments down below about your own experiences and challenges with Orlistat. And if you found this video helpful, please leave me a like. As before, I'm Dr. Brian Young, bringing you weight loss info on this channel. Subscribe and hit the notification bell if you're interested in learning more, and share it with someone you know can use the help.